Anna, this morning, we always talk on Thursday, set aside some time to talk about medicine. Joining us today, Dr. Marzena Krawiec. You said it to me and I still messed it up. She said just like Lenny Krawiec. Marzena Krawiec is here talking about allergies, pediatric allergies. And I was going to say, so with a little bit of rain that's come through, when that happens, how much of that just help to begin with?
It's a big deal. It causes the pollens to be flurrying around. It causes various shifts. The weather itself is a huge factor for a lot of kids that have asthma and allergies.
I know, I've got 8-year-old twins who this year, just like every other kid that was out there, you saw the nasal stuff going on. But as a parent, I look at it and sometimes, all right, is it a cold? Or is it how do you differentiate between the two? It's
actually very hard, but typically colds are going to involve fevers. It's going to cause changes in the amount of mucus you have and the degree and discoloration of the mucus. So if you have more discolored mucus and you have changes, then you have to worry about an actual cold versus allergies. Allergies are typically clear nasal drainage, scratchy throat, scratchy eyes, itchiness.
When you're talking about children, too, I know the medications, you're always reading labels, and it's hard to figure out something, for kids that are that small to give them. What are some of the ways that you can help kind of lessen the load for them?
Well, I mean, the most important thing is, what does every mom leave the nursery with? A bulb syringe and saline.
Yeah.
It's critical to maintain nose patency because the nose is your natural airflow. If you do not have your nose, you don't have a natural humidifier, temperature regulator, and humidifier. So open up the nose, especially in young children. So use your saline, use your bulb, teach your children early how to blow their noses, and then start thinking about your over-the-counter antihistamines. But also talk to your doctor about nasal steroids because they're very effective.
Yeah, I remember leaving the hospital with that blue bulb and not being afraid to use it.
Even asthmatics, we tend to forget that the airway starts at the nose, and so everybody's putting these kids on all these medications for the lungs. Start at the level of the nose. Open up their noses. Babies especially are obligate nose breathers, so if they cannot breathe through their noses, they're going to start belly breathing, they're going to start having trouble. Teenagers are going to have trouble because they're not going to sleep well at night because they're obstructed, and then that can cause changes in REM sleep and obstructive sleep apnea potentially. So it's critical from a neurocognitive standpoint as well.
We always say if you have any questions, you want to contact the doctor, you don't want to email me. All right, Doctor, I appreciate the time this morning. Thank you.
Absolutely. Thank you.